Hey, practice owners. Welcome to another edition of Coming Back Stronger. I'm very excited to have our guest on, Kathy Jiamboi of CreativEdge Marketing. She's going to share some sort of hands-on, nuts and boltsy things you can do in your marketing right now while you're home and, should be paying attention to your practice when you can't see patients, as opposed to binge watching Netflix. Or Kathy, I just heard that online gambling is up 500% in the past 6 weeks. So this is a better way for a practice owner to spend their time, I think. So how you doing? You're
Great.
in sunny Cleveland?
Yeah. No, we had snow today. Do you believe that?
Oh my God.
Woke up to about like 3 inches of snow.
Part of me wonders, because we had record cold. It was 22 degrees yesterday in Louisville, Kentucky, for crying out loud. There's a virus, there's cold, there's a week ago, there was the pink moon or whatever, maybe it's all lining up. Who knows?
Oh, weird, right?
Yeah. No, I think we're, as far as businesses go, a lot of times dentists who are trained as dentists don't think of themselves as practice owners. They're happy doing the dentistry and they know they own it, but the office manager takes care of all that stuff. And now they are, I think outside of they're never been farther outside of their comfort zone than right now.
Yeah.
They're the owner. It's hitting them on the head. They have to think about coming back. What does that look like? Should I be doing anything right now? And, in the area of marketing and branding, we talked earlier, there's a lot that you can be doing right now.
Absolutely.
So if you want, you want to take a quick minute, sort of explain who you are, who CreativEdge is, how you got here, and then, dig into maybe some tactical hands-on-y things that practice owners can be doing right now.
Sure. So CreativEdge, we've been in business. This is our 23rd year. And I initially started the business working with all kinds of different businesses. And for the past, this is my 11th year working solely with dentists. So the way that we work with practices is more of a customized way. So when we start working with them, we learn about what's happening, where they are, and then we develop a plan based on that. So we look at all aspects of marketing. We look at internal, what's happening with them online and digitally, as well as external marketing. And from there, based on where they are, then we put together what they should be doing. So from that standpoint, we know a lot about what goes on internally. And that's one of the things that I think they could be doing right now, are some things internally that would help them, that they can certainly do on their own.
Yeah, you have a lot of docs who think, I'm not seeing patients, so therefore, we're doing nothing. But that's what you were saying earlier. Technically you can do that. But in this post-corona world, we'll call it, if you do that, I think you're going to find yourself, behind your competition. So, okay, awesome.
So one of the things that I see when we start working with practices, we take a look internally what's happening. And I look at referrals. And what they can do is go in and look at their active patient base, get the number there, and see how many referrals that they are typically getting. And we like to set a goal of 15 to 20%. And I'm going to say that most of them are going to be woefully short on that, because this is an area where we work on. So what they want to be able to do there is create a system, because most of them have referral programs, but the patient doesn't know about them. So they really don't get referrals. And so what they want to be able to do is have a system where everybody in the team knows exactly what they're going to do and how they're going to go about asking for a referral. Okay. And having that written and going over that with the team on, here's how we're going to do this from now on. We like to focus on the new patient. And when that new patient comes in, giving them some sort of gift, talking to them about the practice, talking about the doctor and how great the doctor is and that they're in the right place, and then telling them about the referral program, whatever that may be.
Okay.
Now, I know there's laws on states, and I don't know what every state law is, with regard to referrals, but there's ways you can do that no matter what. If it's a donation, or if it's a credit on the account. But in the end, it's more or less saying, hey, we build our practice with people like you and referrals from people like you. And this is, we would love to have more of people like you. And sitting down with that patient and giving that patient more of a wow experience from the beginning so that they will go ahead and refer. And then when they can then present them with some type of referral card, whether that be a business type card or a plastic card, we like to use plastic cards because they have more perceived value. Mm-hmm. Then that gives them, the mechanism to go ahead and pass that along to somebody else. And then from there, if they talk about it in their morning huddles and say, okay, who are we targeting for referrals today? How many referrals did we get? Have we gotten? Where the doctor makes it a point of going over that each and every day, then it'll set the habit in with the team.
Okay. So is that again, a thing they could do now? And I would suspect, you tell me, but a lot of practices might have started that 5 years ago. It was a neat idea. Doc went to some CE, came back and said, here's a plan, and it's tapered off. And, they were gung-ho at the beginning, but now we do it occasionally. Now's a good time to, I would think you'd suggest, for lack of a better term, write that out.
Right.
Make it formal. And mm-hmm. This is what we do every time, so that when you come back, it just becomes part of your new checkout process, check-in process, protocol. Okay.
Yeah. And then they'll be able to see, and they start tracking it, and they'll see an uptick in those numbers, because the referral patient is the best patient they can get. Mm-hmm. They're already pre-sold. They don't complain for the most part. They're just like the person that you asked for the referral. And so that typically turns out to be a pretty good patient.
Okay. Awesome. So, and again, even though you're not seeing it, referrals is a great place to lay the groundwork for when you come back. That might be, so basically you're moving it up the chain of priorities.
Correct.
You're going to need patience when you come back. So maybe here's a question. My belief is patients are going to look at their practice, at their dentist, a little differently when post-corona, we'll call it.
Absolutely.
And so you better be ready to position that way and sort of answer the question before it's asked. So when you're talking about, we talked earlier about PPE, a term, right. I was in the industrial world and telecommunications world. It's just part of it. And 6 weeks ago, America, a very tender, small slice of America had ever heard of PPE. Now everybody knows what it is. So that needs to be part of, I guess, what you communicate to patients.
All right, sure. Should be
your
part
referral,
of that new patient, telling them exactly what you do with sanitation and sterilization and all of that. And even, I was talking with another practice management person in dental, and we were talking about how, it might be good for them to even have some type of, hey, here's now what we're offering. Mm-hmm. If you would like, your own mask and your own, whatever that can make them feel more comfortable about being in that environment.
So to some degree, you're kind of, maybe think of it like this. I mean, not technically, but you're reselling, so to speak, your old patient, and then asking for a referral when they come in and they say, wow, I feel comfortable with Doc. With all the heightened awareness that they have, and their radar is up for all these little things, they're comfortable with you. That's the best time to ask for the referral.
Absolutely. Okay. Right. Or when they're so happy with what you've done.
Right. Okay. Awesome. All right. What else you got?
Okay. The other thing that I see that goes on is with recall and reactivation.
Okay.
So typically a lot of them have automated systems, mm-hmm. Where they're using maybe Lighthouse or Solution Reach or one of those that can text message and send emails, reminders. And then they may or may not be doing some other type of recall or reactivation through phone or mailers. Mm-hmm. So, but they're not usually hitting on all four. So it would be what I would suggest doing, and what we do is we'll go in and we look in the system and we see exactly what the capabilities are of the system that you're using. And you want to maximize that system out, because most practices are doing about, what they tell me is about 6 times. So they will contact 6 times and that's about it. So then what happens? Where are those? They're like in limbo. And, and oftentimes there are those patients that do get into limbo for whatever reason. So I like to set up a system that, you want to utilize the automation, but to also have some type of a manual system that you're tracking as well, so that you're keeping track of all the, what the contacts are among those patients and where you are in that, and keep calling them and using all the systems. So I'll go in and I'll say, okay, in this system, I can send X amount of text messages and I can send so many emails. So let's go ahead and map that out. And then in between, I can fill in with phone calls and a mailer. And then what I like to do too is then make sure that the messaging gets stronger as the time lapses between the appointment.
Okay.
Does that make sense? So
they don't not repeat the same thing over.
Right. And if you look at most of the systems, they're on the default. They're on whatever the system default is. And the messages are like, hey, you haven't been here in 6 months. You need to come in.
Yeah.
No, but it doesn't go to the point of educating them on what happens. Hey, if you haven't been here in 4 months, you've got bacteria built up all over, so that they, and then just kind of keep the education going, and so that they understand that this is serious. This is not a good thing. You need to have your teeth cleaned, so. But that is a great area. And when we have been able to implement a more robust recall and reactivation, the numbers and that's perfect for now too, because there's a lot of people off the schedule.
Right. Or again,
you want to know who are these people?
Yeah.
Right? Okay. I mean, I'm sure they have lists of them now, but there's more than that list that are not on the schedule.
Or you had a plan, a protocol, again, 5 years ago or 10 years ago when you started your practice, and the utilization might not be. I'm using a big fancy word there. Your utilization might not be what you thought it would be, and so we technically had a 5-step or 6-touch process, but we really do 2, and we forget it, and we really haven't looked at it, and So now's a good time to go in and say, okay, what is it? And sort of polish up your reactivation and recall program. And, and so that when you get back and you pull the trigger, now there's a whole new expectation. And you've got a different message, I think, right now. I think the coronavirus message, I think it also, it dovetails into just we're a concerned, clean, healthy practice, and and you're the master of the messaging part, not me, but it would be something like, especially mom, dad, and 2.3 kids. Mom brings the kids in, that radar is up for things they can touch that are dirty, things they can touch, and it used to just be a little dirty. Now it's, oh my gosh, they'll get the coronavirus and it'll kill my kids.
Well, it's all like that communication. I've talked with a lot of dentists too that we're talking about how they want to do that. It is, let people know, so this is what I'm gathering right now. So we're putting this together, is let people know what you've done in the past, because they don't really even know what you did every day. So here's what we always did. We have always been a sterile environment, but this is what we're doing now. We're ramping it up and we're adding these other layers to what we're doing. And I think that would go a long way too, to being part of that messaging, when you're getting ready to come back.
You have a lot of patients who, when you call them, their view of a clean practice or a healthy practice is different than it was 6 weeks ago. Right. It wasn't even on their list 6 weeks ago. Now it's, how you handle this is certainly is way up their list. Again, like somebody said, dentistry is one of the few professions where you touch your customer. You're in their mouth, you're in their kid's mouth. there's all kinds of things going on with bodily fluids and dental aerosols and all that. I think they just want to be comfortable. So you don't have to get technical, I guess, is what it comes down to. You just want to be conscious that you've communicated and they're comfortable.
Right. Or even saying, hey, we're going to offer you your own mask or your own, whatever, if you would want to wear gloves, whatever it might take to make them feel safe. I think that's really important too.
And that is so again, I guess if you take them for granted, they may not be your patient anymore. When you go to reactivate them, you may find that they've gone to somebody else just because they felt more comfortable, or somebody said, oh, my doc is clean, it's squeaky clean, or whatever that new definition is, whatever language that we're just now figuring out in our industry. Yeah. So reactivation is critical, but you also kind of have to make sure it fits with your branding and your messaging and all that. Mm-hmm. Okay, awesome. All right, 2 home runs. What else you got?
Let's see. What else could we do? I was trying to think internally. I think one of the things too is to take a look at your practice with fresh eyes. That's a big thing, walking in and just looking at it like you're coming into it. What do I see? Because I think if you can do that, or even if you have your spouse come in too and say, hey, take a look for me, or maybe your children or somebody else that can kind of give you another different view. Because you might see some things. You might see the web up in the corner that you never see because you don't look that way. But there's probably a lot that could be caught that way and spruced up. Landscaping out in the front, all kinds of little things that you just kind of let go. And now you've got a little time to do a little landscaping, right?
Think about it. Maybe
who isn't doing that?
Right. Again, you've got a gift of time here. Use it wisely. You're looking down on a patient all day long. Right. Patients are laying back, looking up at the corner.
Right.
And you might find that, there is a big nasty cobweb and some spider eggs that, people kind of didn't give a second thought to, but now they are. That you've never seen because you're looking this way and now they're looking this way. Right. And then you start to wonder, how long's that been up there? And so the other thing would be, somebody made this comment last week or so, that the things that our patients will associate, that fresh set of eyes might find, are things like papers, some kind of a notice you taped to the front of the operatory cabinet, 5 years ago that, I don't know, whatever it might be, communication to patients. And then you scratched out, you put a Post-it note over it and all those kind of things, or a neat plant.
All junking it up, right?
Yeah. And it, you don't notice it anymore. It's your stuff. What do they say? We don't notice our own clutter. But your patient will now. So your patient looks at it and says, I wonder if they wipe this down. They can't wipe that piece of paper down. So you don't even have to mention it. They're already thinking that. And suddenly, again, no reactivation, no referral,
right?
A lost patient over something that you've looked at every day and was never an issue until now. So right. that's really smart. Yeah. Mm-hmm. Yeah. So I always used to say, I used to tell docs about the exterior of their practice. And this might not fit with, the inside, but I would say, drive down the street and get somebody in the car with you and look at your practice as you drive up. And then as you get out of the car and as you walk in the door, and, have them write down things that they noticed. And then you write down things that you noticed. And it was always amazing that they would have, that sign is broken, that light's out, that bush is dead. Did they buy this furniture in 1984? And all these things. And the doc would say, I've never noticed any of that. Well, number one, you always come in the back door.
Right, right.
Number two, it's kind of okay because you come every day. They come every 6 months. And so, yeah, that's pretty smart. Inside, I mean, there's got to be a lot of things you would notice that, right now.
Right. Even in the waiting area, right?
Yeah.
All the raggedy magazines that might be in there, or, whatever it might be.
the raggedy magazines that might have, you know,
germs all over
coronavirus
them.
all over them.
Right.
Yeah. And that's what your patients are going to be thinking.
You know that. They're going to think that way.
Yeah.
You're all going to think. Like, even I went to go to the grocery store, and I don't know how your grocery store is, but, you know, they don't bring the bags.
Right.
You know, don't. Right?
Yes.
If they were bring the bags. Now it's don't bring the bags. So
it is. I saw where San Francisco, they they banned plastic bags because I don't know what it was doing. It was, you know, something was going on, something bad. It was going in the ocean and it was killing the fish or whatever.
The island of bags, right?
Yeah. So no more plastic bags. Well, then 2 weeks ago, they said, no cloth bags, no bring your own bags. You have to use plastic, but they don't have any plastic bags because they banned them all. So, you know, those are things that we can sort of laugh about, but they're big structural things that, you know, I guarantee you the biggest grocery store in San Francisco doesn't think it's funny. It's an expensive proposition. And stores that don't. So suddenly now it's not about saving one thing. It's saving, you know, my grandparents or my, you know, my dad or me.
Saving a human life, right?
Right. So it's so those are things that I think I'm guessing that your days are sort of filled with trying to figure that out.
Right. And getting with all of the doctors and knowing what they're doing now and what they're changing up and moving forward with, you know, I have even doctors right now that are seeing emergency patients, and we're running Google AdWords for that.
Okay.
And, you know, so I mean, that's available too. If somebody out there is wanting to see emergencies, and it's working pretty well. I mean,
there are a lot of docs who don't see anybody, and so and the other thing is, you know, emergency rooms used to see 70% of dental emergencies.
Mm-hmm.
Dentists only saw 30%. Well, now you can't go to the emergency room. You know, they're going to say, listen, if you don't have coronavirus or, you know, you're not shot or stabbed, get out of here.
Right.
So I've had people tell me that their emergency calls are off the chart. And then I've had people tell me, yeah, my email or my voicemail is full with emergency calls, but we're not seeing patients.
Right. There's that.
Somebody is.
Right.
Somebody's seeing a lot of them. So yeah, that's awesome. So can you do that quickly? I mean, if, you know, you do that every day with AdWords.
Yeah. It's pretty quick.
So you change that, you just change it to sort of emergency dental or whatever, because again, I read where 65% of patients are finding dentist and their new dentist on their device, on their phone.
Most of the emergency, I was actually looking at one of the campaigns that we're running right now, and most of the leads are coming from mobile device.
Mm-hmm.
So
you're driving along, or you're saying, and my kids, this is their computer.
Yes.
You know, they print from it and mail from it, and, you know, they don't even have a desktop computer anymore. They have this. But so part of the, I guess with this, the idea being the emergency room turned you away. You're looking for a dentist, and you say,
emergency dentist.
Yeah, Dentist Cleveland, emergency. And with Google AdWords, when you change that, you suddenly, if you're seeing patients, you bubble to the top.
Yeah.
They're going to call until they get a ding, till somebody answers, and they're going to say, you know, the emergency room turned me away. I got this going on. Can you see me? And yeah, it's billable and it's legal. It fits within the guidelines of the ADA in most states. I would check that. But,
yeah, right. I think you do need to check with the states, because I think that is, I think there are some that are not. There's guidelines, I know.
Yeah, but that's really smart. You have people actually doing that now. They got ahead of it.
Yeah.
A couple of weeks ago said, hey, change my ads from cosmetic dentistry to emergency.
Right. And we're also doing, you know, for those that do like dental implants or any like higher end procedures, maybe they do orthodontics, or, you know, something where people don't just go, oh yeah, schedule me. You know, they kind of look into that. That's a place where we're running more along lines of ads where they are targeted for them to get information. So it's not schedule an appointment, but hey, here's a guide that the dentist wrote about, you know, the top things you need to know about orthodontics, you know, or that kind of thing. So, and putting those out there where we're getting them to opt into the guide, and then we're capturing their email address, and now we're working to nurture them and walk them along the path of becoming the patient. So
it can start now.
Right. Because it's not a snap decision typically when they're going to spend, $40,000 to have their mouth redone. They're not going to just hit the buy now button.
Mm-hmm.
So they are looking at all their options, and it's a way of getting people to, there's Facebook right now is probably one of the most used platforms.
Oh,
so
Facebook is going crazy.
Right.
Yeah.
That's the place to run some ads.
Yeah.
And I know that their ad revenue is way down. So, you can also get cheaper clicks, if you will.
And Facebook ads are really inexpensive compared with anything else.
Compared even with Google, for sure.
You can have a $20 ad spend on Facebook and reach a lot of people in, I guess you can target it, right? So it can be Cleveland, this zip code, and this treatment. And, for a very small amount, you start showing up in the ads.
Right.
Awesome. Well, Kathy, that's a lot of value right there. What if somebody wanted to reach out to you and maybe ask you a question or so, you'd be open to that, right?
Sure.
Awesome.
And what, right now, I probably would give you my cell phone number.
Okay. So how would how would they get a hold of you email wise?
Email would be Kathy with a K at creative, DGE, marketing.com. So it's Creative Edge Marketing, 1E.
With 1E in the middle. It goes together. That's pretty clever.
Yeah. Thanks, Steve.
And we'll post a link, so all they have to do is click it and make it easy.
Sure.
Well, good. Well, Kathy, I know you've gotten, we talked earlier, you get a lot of clients who are suddenly saying, what do I do? What do I do? What do I do? And I think you're pretty good at saying there's a lot you can be doing right now.
Absolutely,
so let's focus on what you can do, not, you can't see patients. So let's park that over here. But you can be doing things like you said. I mean, your referrals, your referral system that, you haven't really used for a long time, your reactivation that, you never seem to get around to, things that you can build your system. And when you come back, it's working again.
Right. Well, the thing too about both of those systems is they're foundational. So then when you have new patients, you've got that already established and it's there. Mm-hmm. If you don't have good systems in place, you're missing so much opportunity.
Yeah.
And even with the recall and reactivation, how much, how open is your back door?
Right.
So this just helps to seal that back door and keep everybody with you.
Yeah, I think it can also help keep your mind in the right place. You're still a dentist. You still have a dental practice. You're still a practice owner. That didn't stop. Yeah, so awesome. Well, Kathy, I appreciate you coming on. Any parting thoughts?
Stay healthy.
Yeah.
Stay safe, right? Wear your mask, right?
Yes. Well, and that's a visual. So a neat thing is that's a visual for your patient. So you can tell them one thing, but you show up and you don't have a mask and your staff doesn't have a mask and you're kind of using your PPE, but not really. The post corona patients, they'll notice that. So
right.
Yeah, that's smart. Good advice. So Kathy Jiamboi, CreativEdge Marketing, and we'll post Kathy's email address. And Kathy, I appreciate you sharing that. I mean, that's some awesome advice or tidbits for practice owners who are looking to come back stronger.
Thank you so much for having me, Steve.
All right. See you soon. Thanks, Kathy.
Bye-bye.
Bye.